Now, I want to give a huge shout out to the New York State Attorney General, Letitia James. You can go to the Office of New York State Attorney General's office online, and you can see that she has filed a lawsuit against the Trump administration. Dangerous dismantling of health and human services. Again, real talk. The New York State Attorney General, Letitia James, announced a lawsuit to stop the most sweeping and unlawful assault on public health in our nation's history. Real talk. This administration has taken a wrecking ball to the Department of Health and Human Services, is responsible for protecting and preserving public health. And since taking office, this administration has fired scientists, closed labs, shuttered life-saving programs without rhyme, reason, or any legal authority, nothing but devastating consequences for millions of Americans. Now, when we talk about real talk, that's real talk. So I've been waiting to see when was someone going to file a lawsuit, start the impeachment process.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduce stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. Now, today I want to have some real talk with you. For those of you who don't know what I mean when I say real talk simply means I want to have an honest conversation. Not that we don't have real talk here on Nurses with Voices, but today I want you to really think about what I'm going to share with you. And real talk means that you're going to hear what someone is saying without being defensive, without having an opinion about it. You're really just listening to understand and not listening to respond. When you have real talk, you communicate to understand one another. So today I want to have some real talk, and I want to have real talk about a few things. But first, I'll start off with what RFK Jr. has done with the CDC. So I'm going to read something to you. Health and Human Services Secretary Robert F. Kennedy Jr. announced he is replacing the entire independent committee that advises the Centers for Disease Control and Prevention on vaccine usage, claiming members had too many outside conflicts. This is according to a news update by CBS. So feel free to fact check me. And I think what's important here is to think about and consider how this decision affects our community, our healthcare system, and why we have someone like this overseeing health and human services. This external panel of experts has been guiding on vaccine safety for decades. Now, not only are we removing or replacing the committee, we are now saying we're going to have a say-so on what data actually is going to be shared during these panels. Does that not compromise or infuse mistrust within public health? Why are we doing this? And why does this make sense? What's the purpose of the revamp? What's wrong with the processes, and why are we now selecting and picking and choosing the data that is going to be infused into these panels? What is taking place in the administration? And it kind of leads me to my next point. And here in New Jersey, today is voting for the primary elections. And this is where our voices start to be heard. And how we make our voices heard is by making decisions in the legislative process. How you make a decision in the legislative process? By voting. Yeah. By voting, that's how you win. That's how you take your power back, is in the voting process. And I don't think people understand that. The voting process is how you take your power back. Now, I want to give a huge shout out to the New York State Attorney General, Letitia James. You can go to the Office of New York State Attorney General's office online, and you can see that she has filed a lawsuit against the Trump administration. Dangerous dismantling of health and human services. Again, real talk. The New York State Attorney General, Letitia James, announced a lawsuit to stop the most sweeping and unlawful assault on public health in our nation's history. Real talk. This administration has taken a wrecking ball to the Department of Health and Human Services. 3. HHS is responsible for protecting and preserving public health, and since taking office, this administration has fired scientists, closed labs, shuttered life-saving programs without rhyme, reason, or any legal authority, nothing but devastating consequences for millions of Americans. When we talk about real talk, that's real talk. So I've been waiting to see when was someone going to file a lawsuit, start the impeachment process. Now, and I'm guessing maybe the impeachment process can't really start until the Democrats have control of the House. And this is where, or the Senate or somewhere. And this is where your voting comes in, right? Because Democrats are, and I don't want to say they're sitting back, but there's not really much they can do when you have an administration that controls the House and Senate, right? This is why voting is so important, because otherwise we're going to continue to have all of these devastating attacks on not only healthcare. I'm speaking to the healthcare industry, obviously, because I'm a nurse, but look at all of the other industries and look at the domino effect. And I think the lawsuit says it best, the wrecking ball that is just taking no mercy on the economy, on public health, on the country as a whole. And it saddens me. As I digress, I talk about these things because they are important. And a lot of times, and I've said this in, again, real talk, I said this in the episode last week, a lot of times as nurses and healthcare professionals, we work in our silos. But with everything going on right now between hospital closures, staffing shortages, workplace violence, all of these things are important. It's important to have our research. When we look at grants for research grants, there's been about 2,100 grants that have been terminated that goes along with our research. Now, science, workplace violence, some people may say, what's the comparison? The comparison is the fact that there is an administration that has taken a wrecking ball to our country, and everyone is being affected. Absolutely everyone is being affected. And we have to let our voices be heard. And, when we think about grants, why are grants important? Grants are important because the grants has been what's been able to fast forward our economic development in our country. When you don't have certain groups, you leave the country, healthcare in particular, again, I'm speaking to healthcare, you leave the country vulnerable. It goes back to leadership. These type of issues are really why I push for legacy building, because you start to lose trust in the country. When you start to lose trust where you live, it really starts to, this is how all the fear and anxiety and no one knows who to turn to, where to turn to. And this is one of the reasons why I went out on my own, started and went into entrepreneurship. And from entrepreneurship, with everything that has happened this year, this is one of the reasons why I started the Nurse Legacy Accelerator program, because we have to start learning how to build our own legacies. Because if we haven't learned anything else, we've learned this year, just in these past 6 months, 5 months, however you want to call it, we've learned that you can have the rug just pulled right out from under you in a blink of an eye. What's the saying? When you stay ready, you don't have to get ready. Because right now, you have to stay ready and prepare for what may happen to you. I'm going to end this topic on this because I want to segue into what I really want to talk to you guys about today. And with RFK Jr.'s recent move to dismantle the CDC's vaccine advisory committee, we are witnessing a seismic shift in public health leadership. One that raises a powerful question, or powerful questions, I should say, about who holds decision-making power and how legacy systems are being challenged. Something to think about. On the opposite end of the spectrum, we see NASDAQ mentee cohorts graduating, stepping in confidently into spaces where they once believed they were out of their reach. These emerging voices are proof that leadership is no longer reserved for a few. It's for those who are ready. So when you stay ready, you don't have to get ready. Readiness doesn't happen by accident, right? It's built on 3 transformative pillars: mindset, support, and strategic focus. And I talked about this in my LinkedIn newsletter today. I also explore this in chapter 5 of my book, Confessions of a Nurse Executive, when it talks about leadership. And, the power of mindset, having support, and strategic focus, these 3 pillars, they don't just change outcomes, they change lives. And this is what I mean. Mindset is an internal shift. It is a shift that precedes every external breakthrough. It's a belief that you're capable. It's that you're deserving, that you're equipped to lead in the highest level. Having a growth mindset, that's where all of those capabilities come into play. Going from being a nurse in the hospital and working with the bedside, or working in leadership and working with a particular population, and then going to being an entrepreneur, yes, there were a lot of skills that were transferable, but there was a mindset shift that needed to occur because I was no longer working for someone. I was now the boss, right? So not just the boss of my unit, I'm the boss of an organization now. So there's no reporting to someone reporting out. I'm reporting to myself, right? So there's a mindset shift that needed to occur. The type A personality that took place inside of the healthcare system, that had to kind of go to the wayside because I had to learn to be adaptable and flexible, which I learned from being a travel nurse, right, throughout my career. So again, a lot of things were transferable, but I also had to learn how to have a different mindset approach to things. And then I had to believe in myself, right? Like after I was able to shake the burnout and have my breakthrough, now my mindset was able to shift. Like, wait a minute. I've been doing this for years, but I've been doing is making someone else rich, building someone else's legacy. Now it's time to build my legacy. So there's a mindset shift that needs to occur. And once you realize that, it's such a game changer. It's a game changer when you shift your mindset. And then let's talk about support. Support is your ecosystem. Everyone should not be in your ecosystem. You have to be very, very mindful of who you allow in your ecosystem. That means be mindful of the networking events that you're attending. Be mindful of the information that you're consuming. You have to be very, very mindful of what you allow in your ecosystem. No one rises alone. So I was listening to, if you ever heard of George Fraser, the Power Networking, my aunt is like really, she follows this man, and every time he's having something, she's always like, make sure you listen and make sure you attend the workshop and make sure. And I'm just like, okay. And I do because, she's my aunt. She's into finance. She's into wealth building. So I know she knows what she's talking about. The workshop included an interview on a gentleman, and the gentleman, I won't say his name. I can't remember his name, but the workshop included a gentleman who was talking about networking. And he talked about how, and he said it in such a comical way, at least it was comical to me. And he talked about how sometimes networking is a waste of time. And I in a way, I get what he means. And my takeaway from what he was saying was basically be strategic. And I think that's what I kind of tell you guys anyway about being strategic. Don't allow yourself to get sucked in and be in rooms that do not serve you. Now, if you're in rooms with people who you all are looking for the same thing, you're in the wrong room. You want to have a support system who can support you. And I think I shared this with my mentees recently. When I was looking to have a 6-figure business, I was around 6-figure business owners. And as you scale, going to 7 figures, same thing. I place myself in rooms with 7-figure earners, right? And then when I want to get to 8 figures, I'm going to be in room with 8-figure earners. I say that to say you want a support system and a network that's going to allow you to grow. And ultimately, that's also a mindset shift. So you see why mindset is so important? It's important to shift your mindset because When you do that, you're able to place yourself in certain rooms and in certain networks and have a support system that's going to help you to reach your goal. That's it. And that's what it's about. It's about reaching your goal. And your support system is your ecosystem that sustains you, especially in healthcare, where burnout and bias runs really deep. And we talked about bias in last week's episode. It can run really deep. So for me, why I talk about this is because when I start to see things in healthcare, when I start to see certain people making certain decisions, there's a huge connection for me. And I know what I did. And it's all the same thing. It really is. It's the same experiences. It's just different people. It's just what they call it, different shades of gray. It's like, it's different shades, but it's all the same thing. So when you know how to deal with it, you deal with it. Whether you're dealing with it because of who you are, because of what your class is. When we talk about classism, no matter what, if you deal with these three things, and the third thing, and I'm going to talk about in a second, if you've ever dealt with any issue with burnout, with bias, if you have a mindset of growth, if you have a support system that sustains you, and if you have strategic focus, you will be able to overcome it. Now, what do I mean? Strategic focus allows you to turn passion into purpose-driven results. It's how we move from survival mode to building sustainable legacies. I'll give you an example of what I mean. One of my mentees mentioned that she's thinking about going back to work. She's doing great things. She's networking. She's expanding her network. She's meeting great people. She's being invited to speak on stages, to speak on panels. And this is just the foundationary work that just started happening. And when we talk about overnight success, these are wins, which I know she identifies, but sometimes the money may not come right away. But what you're doing is you're building authority, right? You're building that authority so that when people do come to you, or when you do reach out for that particular contract that you know that you're more than qualified for, or when you reach out for that particular speaking engagement, this is just the groundwork, right? Like, we're just doing the groundwork. But I also understand the strategy of going back to work in the meantime, because sometimes we quit. I quit. I I quit my job. I didn't know where I was going to go, or where I was going to. I've made no secret of this. I quit my job, and then I just was like, okay, now what now? Like, okay, what now? But I say this to say, there's nothing wrong with having a strategy and saying, you know what, I'm going to work here for a little while because my goal is XYZ. But what you have to be careful of is making sure that this is a strategy move, so that you don't get sucked right back into that 9 to 5, or you don't get sucked back into working for someone else when you know you have a passion to build your own company and build your own business. This is the networking, the speaking on stages. That's the foundation. That's the groundwork that you need to do. And again, this is why mentorship is so important, to help you get from here to there. That's how you get from where you are to where you need to be. That's how you do that, is by being strategic. So if you have those three things, mindset, support, and strategy, you could become such a change maker, and a change maker as a CEO. And again, this is exactly why I created the Nurse Legacy Accelerator Program. Because sometimes 12-week programs are great. Well, let me be clear. The Nurse Legacy Accelerator Program is a 6-month program. I've provided the opportunity to do 12 weeks. Realizing that 12 weeks, a lot of times, is just the foundation. It's really just the groundwork that you need to be doing. Because it takes 90 days to either form a habit or break a habit. So you really need at least 6 months to be able to break a habit, form a habit, and be able to really start to build and scale. And this is why the Nurse Legacy Accelerator Program is 6 months long. Now, you have people who come in at different levels, and they may only need 12 weeks, which is why I have the 12-week program. So to give you an example, I have one young lady who, she already have structures in place. She already have family members who, they're in business and they're going to help her do X, Y, Z. She just needs the 12-week piece of the program because it's so niche as it relates to healthcare, right? And IV hydration. And so she just needs that 12-week piece, which is cool, right? So this is going to help her out. But then you have the people who really need the 6-month piece of the program. And that's where I come in with the 6-month piece. And then we also have done for you. We have done for you options where we're basically giving you a turnkey business, right? But that's a whole nother, that's something else that we discuss. I say all that to say, this is why we include mindset, we include support, and we give you that strategy so that you can focus and so that you can have that business, that strategy focused business that you need. Now, keeping in mind, the Nurse Legacy Accelerator is also about helping you to accelerate your career, meaning we have people who want to just elevate in their career as a nurse. The Nurse Legacy Accelerator program is going to give you that as well. So again, you have people at different levels, and we have different programs within the Institute. And I'm proud of that. I'm proud of that. So right now we do have one spot left available for the program that's starting June 15th. We have one spot remaining in the program, and you do have to apply. You apply, and I think I said this last week, because we want to make sure that we're a good fit for you, and we want to make sure that you're a good fit for the program. So again, so I'm excited. It's time for nurses and to not just survive the system, but to reshape it. We're in a season of disruption, reinvention, across every sector. I was speaking with a young lady today, and I was just saying, like, I just want to rebrand. And she's like, all right, well, we're going to talk about that. We're going to look and see what that looks like. And sometimes your rebranding is about reinventing yourself. Not that I'm doing like I'm reinventing anything right now, but when we talk about strategic planning, right, part of the strategic plan is sometimes is rebranding. I have a lot coming up. I have some exciting things that are going to be coming up in Q3 and 2026. So I'm excited about them. So I say all this to say this is our moment to really step forward, not only as caregivers, but as change makers, CEOs, legacy builders, and thought leaders. When you consider these 3 pillars, they are what changed my own leadership journey, and they're empowering the next generation of nurse leaders to rise, to build, and to leave legacies, to leave lasting legacies. So if you are interested in building a legacy, make sure that you check out the show notes. You can definitely apply for the Nurse Legacy Accelerator program. You can log on to dljamesconsulting.com. I invite you to have a strategy call with me, and we can look at building your legacy. Until next time, make sure that you stay educated, stay inspired, and stay impacted.